All right, well, it's great. Another issue of Sport Pharmacy magazine has dropped. And of course, I have my wonderfully talented, uber smart friend, Jessica Beal-Stahl, joining for a conversation here to go over the articles, the things that were there. I don't know about you, Jessica, but I thought all the articles were pretty awesome.
I love them. They were such timely topics that with the gut health and the impacts that it has on your whole body. I myself learned a lot from everyone's articles. So yeah, I thought they were really, really interesting.
Absolutely, time high five. And
Ah,
and the thing that's always crazy is, I know we were talking about this before starting the recording, is how many things are affected by the gut that aren't physically per se attacked to the, attached to the gut.
yeah, like most people think like you're bloated, you're constipated, like my gut, but most people don't go to the fact of thinking like I have anxiety and that may be because of my gut. Or as we were discussing earlier, like, and you kind of, I'd love for you to explain some more about it, some of the science behind possibly even like conditions like Parkinson's.
Yeah, it's fascinating. And that was the one area, you're like me. If we could write 5,000 words in an article, trust us, we probably would.
No
But,
problem.
we were trying to stay within the limit. And that was the one area I would have loved to have dived more in depth on. My focus was on postbiotics, which are, I always tell them, they're kind of like the corpses of bacteria, the poop of bacteria, there. But here's where it gets fascinating is both bacterial strains, postbiotics seem to affect potentially, again, this is preliminary, animal studies, actual Parkinson's disease. And based off the research I was finding is Parkinson's disease looks like it actually may be caused by the gut, which is crazy. What they're finding is about 10 to 20 years before the first symptoms of Parkinson's disease actually start about 10 to 20 years before the motor problems that people are experiencing, the rigidity, the stiffness, things that the tremors. And it's looking a lot. What happens is, again, very early, but kind of some of the proteins, the different tangles originate in the gut, and for lack of better words, travel upwards into the brain.
Interesting.
So yeah, so that's going to be an exciting area of research, and I was thinking about Parkinson's disease. Where I really started to get into it was a client of mine. His father was diagnosed with it, and we were just trying to find solutions. And, I was thinking about like the Journal of the American Medical Association back in 2020, they released a statement saying that there really is no prescription medications to slow it down. You can control symptoms, but actually slowing down the progression. And so this is where it's exciting, is this might be that new avenue that provides that ability to either slow down it or to halt progression. So it should be an exciting time on that level.
I would say you feel for all the families that have people diagnosed with Parkinson's, that you hope that that comes sooner than later, because I know it has to be hard. I don't have a family member, but seeing families knowing there's no treatment really option, and that has to be hard. But if you know that there's something you can do, or there's a treatment that might be out there, that even if it is starting in your gut and watching certain things in your diet or different things, like that is really impactful, to know that you can maybe prevent or slow the onset of a disease by affecting your gut is, I think, really cool, and something that a lot of people underestimate, I guess.
No,
Overlook, underestimate.
absolutely. And, even just, even if you don't, looking at just, okay, I this is something I'm concerned about. I want to make sure I don't, potentially this may help prevent Parkinson's or slow it down, in the future. But even the effects that you were kind of alluding to earlier is on the stress aspect of things, of how stress and gut impacts. I know that was the focus of your article. So if you can kind of dive into there, some of the neat things you came across.
Yeah. So I think most people probably go with everybody. I mean, I've heard it. You've probably heard it. Everyone's probably been told it at least once, that like, you have a gut feeling, like, and you're like, go with your gut, and like that really, really, like, once you dive into this and start learning about the health of your gut and how it impacts, it really is a second brain. And that statement, while most people think it's just like an old wives' tale or just, it really actually means something. So it's just interesting to see the impact that stress has on your gut, and all the different ways it can impact, in especially long-term stress, and not being able to get out of that fight or flight state, on your gut. And having that lead to further conditions. So long-term stress increases some of like the permeability of your gut. It changes the gut microbiome, which can lead to like anxiety and depression and a lot of other mental health conditions, which I find really, really intriguing, that the food you put in your body not only affects like your mind, but it affects your gut, which also then affects your mind. So have you ever had anything experience with like eating and like the impacts of not feeling well and how that impacts you?
Oh, absolutely.
Everybody?
Say, I think everyone listening right now, their hands could probably go up there.
Yeah.
Or here's a perfect thing too. And I think you may even reference this in your article, but like, 30 minutes before you have to go on, even when I'm presenting to people, I'm like, have you ever had to present in front of public, or maybe before, again, we're talking with athletes here at Sport Pharmacy, 30 minutes before you go onto the court or onto the track or whatever your field of choice is, and all of a sudden you have to go to the bathroom. Like,
yeah.
That is literally a direct sign of how your gut brain are connected to each other.
Yeah. I think it's really cool because it's like, so your body, I guess the science behind it, which most people don't think. So your body's at that point is kind of hyping up. You're getting into this fight or flight state. So your cortisol's being released, your epinephrine, your norepinephrine, and your body is trying to get into that. I need to protect myself. I need to be able to run. I need to be able to move. So a lot of people have one or two things happen. Like they either get constipated and they're like, their body just seizes up and it doesn't want to move or anything. And then you have the other people who are like, I got to go right now. And like, 5 minutes before you walk on stage, you're like, nope, I have to go to the bathroom. I have to go to the bathroom. And that's your body trying to get rid of everything out of your GI tract so that you have more speed and it doesn't work on digestion when you're really needing to run away from something. So I find the science behind that so interesting. And I think I didn't really dive into it, but it's definitely an area that intrigues me, is kind of that role of the fight or flight and stress and your gut on IBS. Because I feel like IBS is one of those conditions that a lot of women face, especially, and you kind of get this random diagnosis of IBS and nobody really knows how to treat it or what to do. And some people just avoid certain foods, but I feel like there probably can be more research and more science behind the causes of IBS and the impacts that your gut actually has on helping decrease symptoms of that disease.
No. And here's what's always fascinating as it relates to the gut, and this is obviously here's the direct, connections between like the vagal nerve. I know that's one that gets talked about a lot, in the science. But I think people even forget too is the byproducts of bacteria fermenting the fibers, the prebiotics. And just for a definition for those listening, you have prebiotics, you have probiotics, you have postbiotics. So just kind of help everybody on the same page. So prebiotics are the food that the healthy bacteria are eating, or I guess any of the bacteria are eating, if that matters, but they're where the probiotics are the actual bacteria. And then postbiotics are bacteria that have either already been killed off or maybe a fragment, so not the full bacterial structure, but a fragment of it, or it's like the byproducts, or as I call it, the poop of the bacteria.
Yes, so they leave you.
Yeah, so when you hear about postbiotics, that's what it's in reference towards. But I just find it so fascinating. I know. And here's where the one part that was cool, and this will directly apply to athletes, is there was a lot in your beta glucan. Wellmune is the trademarked version of it, but a lot of athletes directly in, or a lot of studies directly in athletes, specifically marathoners, showing it to decrease upper respiratory tract infection, improve overall stress levels. There's even one in busy office workers showing that they had decreased stress through the ingestion of it. So, I mean, it's fascinating.
Yeah. Is there, if you were to recommend to somebody, like, what are your favorite prebiotics? And is there any way to, like, your postbiotics, is there any way to consume all those? Like, so what's your recommendation when you talk to somebody about incorporating pre, pro, and postbiotics into their practice of food?
So I'm always looking for pre and probiotics. So actually a gold mine on both the prebiotic as well as the postbiotics is like dark berries. So a lot of those berries are going to have fiber in them. They get fermented. But here's the fascinating thing. People think about antioxidants in terms of how they get absorbed in your body and fight inflammation. Well, most antioxidants, especially your polyphenols, they don't actually get absorbed by the body in their structure, in their intact structure. Basically, what happens is a lot of those polyphenols get digested by the bacteria within your gut. And in the process, it produces these short chain fatty acids, which then gets absorbed in circulation, which has, it helps with the gut lining. There's a lot of research thinking that's almost like the second avenue of the gut-brain connection. So you have the vagal nerve, which is the nervous system, and then you have the circulatory system that's carrying these short chain fatty acids up to the brain as a source of energy and, protective mechanism. So I'm a huge fan of berries. The other thing that I always think about is the moldy food that you forgot to throw away. Just kidding, don't eat that. Just kidding, totally don't eat that. But
are you a kimchi fan? Like,
I was just about to say kimchi, sauerkraut.
Yes.
Those are the big ones that you're grabbing a lot of from there.
No. Sauerkraut is only on New Year's Day.
Oh, I love sauerkraut.
Requirement.
I love sauerkraut. But no, those are the foods that I'm going for. Technically, they've never been quantified, but you think about bacteria, or not bacteria, but like some of your yogurts, or especially ones that have additive bacterial strains into it, because obviously those are going to be surviving. They're probably slightly fermenting some of the things in there, and in the process producing those postbiotics pre-consumption. But like I said, though, that's what your kimchi is, your sauerkraut. A lot of that is obviously the prebiotic fiber as well as the postbiotic, byproducts already in it.
So I'm going to ask this question because it's one I get often, and I want to see your thoughts on it.
Right.
What about kombucha?
Kombucha. So kombucha is
technically about bacteria and having a mother in it, and so let's hear it.
I think you have some postbiotics on it. I don't think you, in terms of actual live bacterial strains, I have not seen enough to have me convinced that there's a lot of the actual bacteria in it, but I do think the potential for postbiotics is definitely present. Or another one is kefir. I think kefir is another one where I think their health benefits, have been, researched with kefir before. There's obviously a lot of different types of kefir with everything there, but those are some of like those functional food products I like. I think sometimes kombucha is overly marketed. I'll be honest with you. I think
it's sometimes I think it's way more sugar in it and added sugar than the actual benefit. It's turned into more of a fun drink than you miss out on the actual benefits of it sometimes. So
no. I think that's where it's at. If it's like, hey, here's a Mountain Dew, or if here's a natural kombucha, then I'll probably go one there. But it's not gonna be like, oh man, I'm feeling really sick today. I gotta find the local kombucha store, going on.
It's just one of those questions. I figured we touch on it on this topic since we're on the gut health, and I know. Let's see, what else are we at? Where else I'm trying to think what else was in my article that really.
Let me see if I can pull it up. Increase intestinal, the GI secretions. Oh, this could be an interesting one to talk about, is just how the gut is a production of various neurotransmitters. And we can kind of talk maybe a little bit about, these neurotransmitters affect regions other than your brain. I don't know if that's worth, going into. And it's been all since I've looked at serotonin, but they think that I would have to look at the science to have on there. But I know that doesn't cross the blood-brain barrier. So whenever I see that, I always try to correct people that way.
I appreciate it. Yeah.
Nope.
What is the top? There's a top one on the article. What was the top bullet point?
Background on GI, fight or flight, changes in GI motility.
Motility. We talked about that.
Increase in intestinal permeability, changes in GI secretions. Stress can cause the brain that turns up pain receptors, making you physically more sensitive to slight increases in acid. Double whammy.
That's GI again. Yeah, symptoms of acid reflux.
Adverse effects of intestinal microbiota.
Is there anything else tied into athletes? I'm trying to think what else.
We could tie it in maybe where what does all this have on the big impact? So obviously this affects stress levels, and immune health, where right now is the probably the greatest amount of research, which I think is on the immune effects in athletes. So we talked a little bit about, we focus more on the stress.
Being curious about your nutrition and what you're eating and how it's making you feel. You know, some people aren't super aware of their body, and some minor changes are, but you know, being curious about, like, are you eating a lot of processed sugars and different things that are causing changes in your gut microbiome? Are you on a lot of, are you taking antibiotics and
Hey,
trying to replace
Jessica,
that, or are you, am I losing you
so
again?
you were losing me. You cut in like mid. You were in your sentence. It sounded like you're talking about like food. So whatever that first part of the food is, were you talking
We'll
about
start
food?
again.
Yeah.
Yeah, we'll start again. Sorry, Chris.
All right.
I'm out. We'll do it again. No, but I was saying, you know, like with your background in
Food. Yeah.
dietitian,
Dietetics.
You think I could say this? I can say drug names and I can't say dietetics. But like, what are your thoughts on like the practical application of, you know, being curious and trying different foods, and actually thoughts on like eliminating certain foods or stopping eating certain foods to see how you react, like whether that be like highly processed sugars or dairy, or for some people gluten. Like, what are your
Grains.
thoughts on that, being a dietitian, for people to try and see if it changes the way they feel, things like that? I'm just kind of curious your thoughts.
No, absolutely. So what I do when somebody comes with where they're just feeling off, especially if they have skin rashes, because this is one thing, I know we haven't, I don't think either of us really talked about in articles, is basically your skin is a reflection of your gut. So when I have somebody who has chronic skin issues, I always tell people, if a cream doesn't clear it up within 3 to 4 days, or it clears up within 3 to 4 days, but then it comes back a week later, it keeps on coming back. I'm like, that's not an actual skin surface issue. That's a gut issue. And so
Same
that's
thing with
when
acne.
it's everything that is coming from the gut. So the first thing I always look at the low hanging fruit. The two low hanging fruit for me is I'll remove dairy and I'll remove gluten containing products.
Okay.
That probably removes the issue for probably 70% of the people I find that irritates them. Now, I'm not one of these people who thinks that no one can have dairy or no one can have gluten products. But that's what I always tell people. If you're sensitive, if you notice, if things are going on, those are the first two that I'll eliminate. And then beyond there, I can get, more specific. Like, especially with athletes, it's so hard to get calories in, especially if you're training hard. I try not to burn down the house just because there's a hole in the window in the the upstairs. I try to make very systematic, easy. And that way, I find so many times that people come, and I don't know if you see this within the pharmacy, but so many times people come to me absolutely paranoid to eat about any type of food because they heard it bad, regardless of what it is. And so again, I'm like, no, food's not bad. Let's just eliminate these two things. Let the gut kind of heal itself. Now, if those don't do it alone, then we'll make other changes. But I always tell people the two golden rules for gut health with me is, 1, eat a variety of foods, and 2, eat minimally processed foods. If we do that alone,
of the grocery store.
Exactly. And the practical thing I always tell people is, at a very baseline, I want you to think about your fist as a serving of fruits or vegetables. I want you to eat at least 6 of those a day. That should be your low water mark. Ideally, for athletes with the stress they put on their body, I want 8 to 10 servings. And ideally, I'm getting that from 4 colors. So here's where it's neat. I've been fortunate to work with a lot of teams, both nationally, internationally, a lot of organizations over the years. And I find if we can just get a minimum of 6 servings of fruits or vegetables the size of our fist, 4 different colors, the rate of anyone getting sick within that group is usually less than 10% over the course of a year. And when I say sick, I mean as simple as they had a cough one day, they had a runny nose one day, anything of that nature. And so those, if I have to give somebody some very easy take-home points, is a variety of minimally processed and 6 servings of fruits or vegetables the size of your fist, 4 different colors.
I love that. That's simple. As a pharmacist, working with athletes one-on-one, you can dive in a lot deeper, but I feel like that's something that everyone can walk away with in counseling a patient on, ways they can feel better or ways they can improve their diet. When a patient at this pharmacy counter is asking you a question and you only have a few minutes, that's a very simple, hey, 6 servings of your size of your fist and 4 different colors. I love it. That is awesome. Good job.
And then think about how can we do this very easily? Smoothies. You can usually knock off 2 or 3 colors in a smoothie. Or another easy way, again, on the food side that when I'm talking with a lot of clients is get the frozen bag of Normandy vegetables or the California blend of vegetables, because they usually have, cauliflower, carrots, and some sort of broccoli in it. So you're able, again, in an easy way, knocking off multiple colors without having to do a lot of thoughts with it. So that's another easy kind of applied tip that I give with a lot of people.
I like those. And I feel like a lot of people, simple changes like that can improve, decreasing gluten, decreasing dairy, one or the other, or sometimes both for people, can make improvements in mental health, can make improvements in sleep, make improvements in your skin, like you said, rashes, bloating, constipation. Like there's a whole list. So Sean, I feel like that's super important and super impactful tips that you just gave, because it's something you can tell anybody. I mean, I can tell a client at the pharmacy counter that I only have a couple minutes with, like, hey, really 6 servings of fruit the size of your fist and 4 different colors. And it's also applicable to kids, right? So if a kid is smaller, their serving size is going to be smaller, but their fist is going to be smaller. So therefore, if I tell a 5-year-old or a 10, hey, eat 4 servings of fruit that are as big as your fist, 6, that's still applicable to them too, because their fist is relative to their body. So I find that's a really good tip and a great way to kind of connect with your patients and give them a nice, healthy goal to work towards. So, and hopefully some impacts on their GI tract too. But definitely enjoyed our chat this evening, and so much about our GI tract that we still don't know. And I feel like each one of us is so different and so unique, and what works for one doesn't work for the other, and how you manifest stress and your immune system and your GI tract is all different based on so many different things, how you were born, where you grew up, the food you eat, your family dynamics, everything like that. And I find that it's as unique as all of us, and that's pretty cool, I think.
Absolutely. And I think you ended on a good point to wrap it up on, is our guts are unique and everyone's going to respond differently. So that, again, goes back to that importance of trying different things, see what works best for your system, because what works well for me might not work for you. But if we go in those general rules of a variety of minimally processed foods, fruits, vegetables, 4 different colors, we're going to be able to find that mix that works best for us.
Yeah. And I think, be curious a little bit, try different things. Your gut does really well when it responds to getting a variety of stuff, like you said, but be curious, try different things, and eliminate. Sometimes it's as simple as eliminating different things to see how your body feels and how your gut responds to it. And you can always add it back, but be a little bit curious.
Absolutely. Well, Jessica, this was a pleasure. Fun as always.
My pleasure too. Right. I enjoyed it. I hope everyone enjoyed my 70s outfit for the night.
Very cool. Enjoy the rest of the evening. I know you're learning a bunch of knowledge stuff. You're at a conference right now. You're always learning. I always respect that about you.
Well, thank you, Sean, and best wishes with all the stuff you have coming out. And I'm excited to see it and help support you with that, and look forward to more talks on GI health and all things sports.
Absolutely. Have a good one.
You too. Bye.